Upon opening a patient chart, multiple menu items will be available. The menu can be seen to the far left side of the screen. Each menu section contains specific patient information. To move from one area of the chart to another, simply click on the different menu names. Also, every chart has a header, often referred to as the banner bar. The banner bar contains many demographic elements and key clinical data details. Some information in the banner are encounter-specific, such as the FIN, admission dates, and locations. Other elements may cross encounters, such as demographics and allergies. FIN and admission information help you to identify that you are viewing the correct encounter. If the user desires to have more space in the viewing screen, the menu pushpin can be unpinned. This allows the menu to hide until needed. Moving the cursor over the word menu reopens the menu list. For this video, we'll repin the menu. Additionally, many individual menu sections have another method to open more viewing space, such as closing the Orders category pane in the Orders tab. This is done by clicking on the sideways arrow at the top of the pane to close and reopen the window. The section that's at the top of the menu list will open when entering the patient's chart. For this position, the Flowsheet doc is the first section. Flowsheet doc contains intake and output documentation and an advanced graphing section. The advanced graphing section includes several pre-built templates for graphs. You can also build your own. Each menu section has unique customization options to alter the details viewed and/or the arrangement of the details. In this section, the defaulted range for the intake and output results is set to a defined clinical range of 3 days. This can be altered by right-clicking in the gray bar displaying dates and choosing Other from the drop-down menu. The search criteria window which opens will allow the user to define the date range to be entered. The section displays all of the documented intake and output results in defined categories and includes balances. The Orders section contains 3 tabs: Orders, Medication List, and Document and Plan. The Orders tab allows users to see all of the orders and order sets placed on a patient for the specific visit. The Orders tab includes the View pane, where the order categories can be seen, and the Orders Profile pane, where the specific orders and their details can be seen. The orders which are displayed in the pane are contingent on the filter criteria defined above the pane. To change the Orders filter criteria, click on the hyperlink at the top of the profile. Choose one of the pre-built sentences that best fits your needs, and click Apply. The medication history documentation and reconciliation history can also be seen in the Orders tab. The Medication List tab on the Orders page shows all medication orders for a patient. The Med List contains prescriptions and documented home medications, which are not seen on the Orders tab. The default filter is to display all active medications. The filter seen at the top of the profile pane can be changed if inactive orders are needing to be seen. The Document and Plan tab includes such things as interdisciplinary plans of care and nursing plans such as fall prevention plans. The Medication List menu item contains all of the same areas and contents as the one that is seen on the Orders menu section. The only difference is that if you choose the Medication List menu item, the initial focus will be on the medication list instead of the Orders tab. The Notes menu contains all of the documents created for the patient. Many sorting options and filters are available for this menu item. Go to the Viewing Patient Chart Documents video for instructions. The Diagnosis and Problems tabs includes all of the documented problems and diagnosis for the patient. The diagnosis should be encounter specific and the problems cross encounters. You can filter either one by choosing the drop-down menu and selecting All, Active, or Inactive. The Allergies tab also includes the documented allergies for the patient. This tab can also be filtered by using the drop-down menu and choosing between All, Active, or Inactive. The Histories section includes multiple history tabs. Which tabs exist may differ from position to position. This view includes family history, past medical history, procedure history, and social history. Some users may also have a pregnancy history tab. The Family History tab includes health history, both positive and negative, for the patient's relatives. This tab can be filtered by using the drop-down menu. The The filter options are Condition View, Family Member View All, and Family Member View Positive Only. The Past Medical History includes information on the patient's medical history. This tab's filter options are All, Active, Resolved, Active and Resolved, Inactive, and Canceled. The Procedure History includes codified procedure information. This tab's filters are All, Active, and Inactive. The Social History includes information documented as a part of the patient intake process regarding pertinent environmental factors and lifestyle activities. This tab can also be filtered for all active and inactive items. The Patient Information menu contains 3 tabs: Demographics, Visit List, and a PPR Summary. Demographics tab contains information specific to the patient and not the encounter, such as vital statistics, addresses, phone numbers, and account numbers. The Visit List tab contains encounter-specific information. The upper window lists all the registered visit encounters. The lower window includes the encounter-specific information. The user can change the encounter to be viewed by double-clicking on the desired encounter. A pop-up warning will display when attempting to change encounters. Changing the encounter within the visit list will change the encounter being viewed and acted on for all the chart sections. The PPR Summary section identifies all patient-provider relationships which have been established with this patient. This section looks at all visit encounters for the patient. Every user who has associated a relationship with the patient chart will be listed in these panes. Both lifetime and visit relationships are displayed. The Immunization Schedule menu section includes a display for CDC recommended immunizations. The upper grid display will vary depending on the patient age. Previous immunizations will display in the lower left. This area contains both historically documented and system-ordered and administered administrations. Future immunizations will display in the lower right. This area displays immunizations with due dates based on the defined schedule for the patient's age. The MAR Summary menu section provides a concise view of the medication administrations and scheduled administrations. The view is set to display all active medications. This can be changed by selecting a different option from the drop-down menu. The MAR Summary view is defaulted to view in 8-hour blocks and look 2 days back and 1 day forward. These properties can be altered by right-clicking in the long gray time bar and choosing Change Properties. The Results Review menu section provides a quick place to view results from multiple types of documented data. Most tabs are self-explanatory as to what they contain, such as Labs 7 days contains labs for the last 7 days. Recent Results tab looks back for a clinical range of 48 hours for a wide range of result types. Each tab is pre-built to retrieve a specific set of result types for a specific time period. Many nursing and ancillary results can be found in the Assessments view, and the default time frame is 7 days back. If the time period desired is not contained in the default range for a tab, right-click on the long gray time frame bar and choose Change Search Criteria. You can choose between a definable clinical range, a result posting range, a result count and years to look back, or admission to current. Keep in mind that the results may take a significant time to load if a large amount of results are included in the time range selected. Many result tabs can be viewed as a table, a group, or a list by changing the selected radio button. The Lab 7 Days, Lab 18 Months, Diagnostics, and Vital Signs tabs all share the same structure and view options discussed with the Recent Results and Assessments view. The Microbiology tab is a bit different. The section retrieves microbiology orders and results and antibiotic orders from the patient's chart based on a defined date range. There's a drop-down option that allows the user to change how the information is sorted. Documentation menu contains all of the chart's documents also found in the Notes menu, but has different filter options available. For filtering instructions, please see the Viewing Patient Chart Documents video. The Growth Chart menu allows users to view various defined growth charts. The charts display the previously documented data plot points. If there are multiple age range options for the growth charts, the system displays the one closest to the age and sex of the patient chosen. These charts are all pediatric charts, but will still be viewable on adult patients.